Knuckle cracking and joint health, separating myth from science. Introduction. Many of us do it without even thinking. Crack our knuckles during meetings while watching TV or to relieve tension in our hands. For decades, this simple habit has been shadowed by warnings. Stop that or you'll get arthritis. But does this popular belief hold up under scientific scrutiny? Recent studies offer a clear answer, and it's far more reassuring than many might expect. Knuckle cracking, formerly known as joint cavitation, is not only common but also largely misunderstood. This article delves into the science behind the popping sound, the myths surrounding joint damage, and what research really says about the long-term effects on joint health. Whether you're a habitual knuckle cracker or someone concerned about your hand health, this evidence-based overview will help separate fact from fiction. Understanding the mechanics. What happens when you crack your knuckles? The audible pop heard during knuckle cracking results from a fascinating process known as cavitation. Inside your joints is a lubricating fluid called synovial fluid, which helps reduce friction and nourish cartilage. When you pull or bend your fingers in a way that creates tension, you momentarily expand the space within the joint capsule. This drop in pressure allows dissolved gases, mainly nitrogen, to form a bubble, which then collapses or pops, creating that characteristic cracking sound. Importantly, this process does not involve bones grinding together, cartilage being damaged, or anything physically snapping into place. The structures remain intact, and the event is mostly acoustic and sensory. After a crack, it takes some time, usually about 15 to 30 minutes, for the gases to dissolve back into the synovial fluid before the joint can be cracked again. The arthritis myth. Where did it come from? The association between knuckle cracking and arthritis likely emerged from a broader cultural tendency to pathologize repetitive or habitual behaviors, especially those that seem unnatural or disruptive. Over time, the belief was passed down as common knowledge despite little to no empirical support. In truth, arthritis is a complex inflammatory condition with multiple contributing factors, including genetics, autoimmune activity, joint injury, infections, obesity, and age-related wear and tear. Cracking knuckles, which involves only gas bubble formation, does not initiate or worsen the pathological processes involved in arthritis. One of the most frequently cited studies in this field was conducted by Dr. Donald Unger, who famously cracked the knuckles of one hand daily for over 60 years while leaving the other untouched. The result? No difference in arthritis or joint damage between the two hands. For this self-experiment, he was awarded the humorous Ig Nobel Prize in medicine, but the data offered a compelling case nonetheless. What the research actually says. Several studies have now addressed the question of whether habitual knuckle cracking leads to long-term joint damage or arthritis. The results are remarkably consistent. A 2011 review in the Journal of the American Board of Family Medicine concluded that knuckle cracking is not associated with hand osteoarthritis. A large observational study tracking over 200 participants found no significant difference in arthritis prevalence between those who cracked their knuckles and those who did not. Some reports note a slight association with reduced grip strength or mild hand swelling in chronic crackers, but these effects are usually temporary and not clinically significant. From a biomechanical perspective, the forces involved in knuckle cracking are not high enough to damage joint cartilage or surrounding structures. Most orthopedic specialists agree that cracking knuckles is a harmless habit for the majority of people. When to pay attention, symptoms that matter. While cracking knuckles is generally considered safe, there are exceptions. If knuckle cracking is accompanied by pain, persistent swelling, joint stiffness, a locking or catching sensation, it may indicate an underlying condition such as tendon inflammation, joint instability, or even early arthritis, unrelated to the cracking itself. In these cases, it's important to consult with a qualified healthcare provider to rule out more serious issues. Likewise, compulsive or aggressive joint manipulation can potentially lead to soft tissue strain or joint irritation, though this is rare and usually resolves without intervention. Psychological and behavioral aspects. Interestingly, knuckle cracking may also serve a psychological function. For some, it offers momentary stress relief or a sense of physical release, similar to stretching or yawning. It may also be a self-soothing behavior, especially during periods of restlessness, anxiety, or boredom. While this isn't problematic in most cases, it's important to remain mindful of context and frequency. Excessive or socially disruptive cracking may be better addressed through relaxation techniques or physical outlets like hand stretches, finger exercises, or pressure point massage. Conclusion: knuckle cracking has long been misunderstood as a risky or damaging habit, but science has consistently shown that it is not associated with arthritis or serious joint damage. The characteristic popping sound is caused by gas bubbles forming and collapsing within the synovial fluid, not by any traumatic force or tissue injury. For the vast majority of people, occasional knuckle cracking is harmless, may even feel relieving, and does not compromise joint health over time. However, like many behaviors, it should be approached with balance. If cracking causes pain or is accompanied by other joint symptoms, it may be time to consult a healthcare provider. In a world filled with dietary fads, untested health warnings, and viral wellness myths, it's refreshing to learn that some habits, like knuckle cracking, might be less harmful than they seem. Science allows us to loosen the grip of superstition and confidently enjoy those small, oddly satisfying releases, without fear of cracking into arthritis.